Hi everybody, it's Dr. B here with Bellissima Dental Boutique, and today we're going to be talking about bleeding gums. So what are some of the reasons our gums bleed? One of the major contributors I see that our gums bleed is because we're not using proper oral hygiene at home, right? We're not brushing twice a day, we're not flossing, and we want to make sure that we're removing the bacteria and the biofilm on our teeth daily to ensure we have optimum oral health and our gums don't bleed. So that's meaning using an electric toothbrush twice a day, at least. That also means flossing, whether that's with a manual floss or using a water flosser. Another reason our gums bleed happens to be because we're not coming in for routine dental care. So whether you're coming to the dentist on a perio maintenance, meaning that we're seeing you 3 or 4 times a year, you definitely need to make sure you're coming in and getting your cleanings and your exams at least twice a year every 6 months. Another contributing factor of why our gums could possibly bleed are hormonal changes. So if you are on hormone replacement therapy, if you're pregnant, even sometimes menopause, all of those hormonal changes, especially for women, can cause inflammation and cause an increase in gingival inflammation and bleeding gums. But last but not least, some of the medications that we take, especially as we advance in age, can lead to more gingival inflammation, gingival overgrowth, or bleeding gums. Some of those medications can be calcium channel blockers, cyclosporin, and phentoin. So how do we immediately stop your gums from bleeding? If this is not due to trauma, that means that we need you to brush better, to come see us at the dentist, and let's get your oral health back on track. However, if it is due to trauma, then we want to either rinse with warm salt water, making sure your teeth and your mouth are clean, and also applying light, firm pressure on the site that is bleeding. Both of those things should help reduce gum bleeding or any gingival inflammation. If you notice that your gums are bleeding 30 minutes to an hour after the start of the incident, you may want to take a Lipton tea bag, dip it in warm water, place it on the site that is bleeding, and bite firmly until bleeding stops. So how do we improve our oral hygiene, right? And make sure that we are not having gingival inflammation and bleeding gums. The biggest things and the easiest things for people to do at home is brush your teeth. Make sure you're using a soft bristle toothbrush or an electric toothbrush. Making sure that you're flossing at least once a day. Also using a mouthwash. One of my favorite ones is Stella Life. It is all natural, all organic, and vegan, and it does a great job in killing bacteria and also giving a healthy environment for your gums to heal. Another thing or another option that you can get from the dentist for people that have periodontal disease is what we call Perio Protect. Perio Protect, you put a gel, an antimicrobial gel, into an aligner. You wear it multiple times a day, and that helps keep the bacterial load in your mouth low, and it also prevents gingival overgrowth and gum bleeding. So, if you experience gum bleeding or need regular cleaning, please give Bellissima Dental Boutique a call at 910-778-1229, or you can make an appointment online at www.boutiquedentalandimplants.com. We'll see you there.